Okay, we're live. Okay, anytime you're ready.
Good morning, everybody. Susan Ehrlich, your CEO. I'm proud to serve with you. Good morning, and thank you for being here for this management forum. February, it's a big month. We're celebrating Black History Month. This Friday, we'll be celebrating Lunar New Year, the Year of the Ox. And this Thursday, we have the Hearts event, which is a very special, of course, Zoom affair. 6 to 7, it's entirely free to you. So please consider joining in. You can register at the San Francisco General Hospital Foundation website. We have a great group of people here for you today to provide a lot of good information, and you can ask questions of them. We'll be talking, of course, about COVID, include the pandemic, vaccinations. We'll be talking about the budget, and we'll be talking about capital projects. But I just wanted to say a couple things before I turn it over to Dr. Winston, who will be our first speaker. You know, we're approaching the 1-year anniversary of the day when Mayor Breed this is a big milestone, and this year has been and at the same time, you all have been just superstars and heroes stepping up to every challenge put in front of you. And I just wanted to say how grateful I am for that. It's just really astounding to know that in the world there have been 106 million cases diagnosed and almost 2.5 million deaths. Here in San Francisco, 32,420 cases this morning and 346 deaths. And though the number of cases per day is dropping and hospitalizations are dropping, which is a great cause for celebration, at the same time, we see those things leveling off. And they're leveling off at a higher peak of when we had our second surge back in July. So we still need to practice vigilance. I know that Dr. Winston will remind us of this, mask distancing and hand washing. And it's going to be especially important because we're likely to be released from the state to the red tier as early as next week. So that, of course, is going to be, you know, more gathering, likely more people together, which increases the chances of the next surge. Luke is going to talk to us, Dr. Day, about vaccines. San Francisco, like everything else for the pandemic, has a very robust plan. And it's really exciting to know that 12% of San Franciscans now have had at least the first vaccination. So that's a great cause for celebration as well. Right now we have enough vaccine to vaccinate about 4,000 people a day in San Francisco, which is well short of the goal of 10 to 15,000 a day. But we've got the infrastructure in place to do it. We're ready to go, and I know Dr. Day will share a lot of details about what we're doing here at ZSFG because we're a really important part of that effort overall in the city. So with that, we'll start with our speakers. Please put your questions.
Yes.
We'll be able to help you with them. So thank you again for being here. Dr. Winston.
All right. Well, thanks so much to Dr. Ehrlich. So I'm going to give you a brief COVID update minus vaccines, which Luke, Dr. Day is going to cover in a moment. So just to start with an overall view of the epidemiology and what's going on globally and nationally, you know, the worldwide epidemic is unfortunately still going strong. And even though the U.S. has had some progress, including progress with vaccines, we are interconnected with everywhere else. And so we are still closely watching what is going on in other places outside of our borders, and hoping that the strategies that we think are starting to work here will also be able to be employed in other places as well. So the U.S. has improved. Many states have gone from, if you look at the maps, from the very ominous looking darkest red color to a slightly red color in terms of transmission. But there's still lots of COVID around pretty much everywhere, including in California, even though our numbers are coming down. In San Francisco, we are definitely improving. We are seeing a pretty dramatic decrease from our peak after the holidays. And right now in the hospital, we have about, our census is in the low 30s in terms of the number of patients that we have with COVID. So that's about half of where we were from our peak coming out of the holiday to the first couple of weeks of January. However, that is still a very high number for us compared to our overall census. And I think it's just helpful to remember that even though we are improving, we are still higher now than we were during our second peak over the summer in terms of the overall number of cases in San Francisco. So we have a ways to go still. One of the things that I've been asked a lot is, well, how much are the new variants playing a role in terms of the surge that we're seeing now? And although we wish we had a little bit more information and even more sequencing in terms of knowing exactly what's going on in real time, I think people are very concerned that these variants are going to affect us going forward, but they probably aren't playing the major role in what's going on now. It's still the same things that it always was when we gather together. We transmit virus to each other, and even our regular old virus is still plenty contagious and can lead to hospitalizations and people getting sick. But there definitely is concern that a couple of the variants are becoming more common, including the UK variant, which does seem to be intrinsically more infectious than the virus that has been circulating, the virus strains that have been circulating most commonly in the US. So what does that mean for us going forward? Well, vaccination is going to be key, and thankfully our vaccines do seem to work against the most common variant strains that we're seeing in the US. And we're just going to have to be very vigilant about other strains against which the vaccine may not work quite as well. There's lots of new data that's coming out all the time. We're watching that very carefully. And it is possible, you know, just thinking about the future, that the vaccines may need to get updated. So this may not be the first time that the last time that we have to think about COVID vaccinations. It is possible that we will have to think about boosters in the future. So one of the things that other things that I'm getting asked about besides the variants is, well, you know, when do we get back to life as we knew it? And in the workplace, that's things like, you know, having in-person meetings and being able to gather. So there's really two big questions that we're looking at to try to answer that. And one is, we have a lot of data now on vaccinations in terms of preventing us from getting sick. I think, as everyone is aware, the two vaccines that we have now, the Moderna vaccine and the Pfizer vaccine, seem to be about 95% effective in preventing us from getting sick, which is fantastic. But we have less information on how good the vaccines are at preventing us from being asymptomatic carriers of the virus, and at what level we might carry the virus, and whether even after we're vaccinated, we might be able to transmit it to somebody else, like a family member or a patient. So the data that are coming out, we have very early data that are pretty encouraging, actually, that we will see decreases in asymptomatic carriage and the amount of virus we're carrying if we do have asymptomatic infection, but it's still a little bit early, and we are trying to be cautious in terms of our recommendations. The other thing that is clear is that there is still a lot of COVID around. And so the more COVID that's circulating, even if we're vaccinated, the more likely we are to get breakthrough infections and to be able to transmit. So, so please stay tuned. We are going to actively be thinking about this, monitoring public health guidance at all levels from the CDC, the state, and locally. But for the time being, continued vigilance with masking and physical distancing is definitely the way to go. I will point out that there is a way that you can help if you're interested in terms of helping to figure out how effective the vaccine is. And that is if you are getting tested for COVID on campus, either as part of surveillance testing or because you have symptoms, you can opt into a study that the CDC is doing to look at longer term effectiveness of the vaccine in healthcare workers. A really, really important question. You'll get a flyer about that if you get tested here on campus, and there's also information about it in the Daily Digest. And we know we've had a number of people who have opted in. You also get a little token of appreciation if you get interviewed as a thank you for your time. And then the last thing that I will say is that you know, even as we're spending a lot of time thinking about vaccines, we're thinking about the epidemiology and the hospitalizations, but we haven't forgotten about therapeutics and how we can better treat people who have COVID. And we participated in a really important anticoagulation study. San Francisco General enrolled a lot of patients in that study. And the preliminary data are very encouraging that there are certain patients who are admitted to the hospital who actually really benefit in terms of receiving full doses of anticoagulation. And we've been able to update our guidelines around that. We still have studies going on in both the inpatient and the outpatient settings to try to add to the knowledge about what the best treatments for COVID are. So I will stop there and perhaps take questions if there are any.
Yeah, let me ask you a couple of questions, Lisa. Are we anticipating another uptick, another peak?
Yeah, so that's a great question. When I get out my crystal ball, I would say that there is fog around around that question. I don't know. You know, I'm an optimistic person by nature. I'm hoping that if we do have surges that are still coming, that they will be smaller and less impactful than what we've just gone through. But I really don't know. I have to admit that I am quite concerned about these variants and really want to get people, you know, vaccinated as quickly as we possibly can and do everything we can in terms of monitoring to know how well we expect the vaccines to work.
So let me ask about the variant. Have you heard about a California variant?
Yeah. So the most common variant that we have now in California is the so-called California variant. And the good thing about the California variant is that the vaccine seems to work very well against it. We know a little bit less about whether it's more transmissible than the strain, than some of the other strains that were commonly here before. But it seems to be plenty transmissible because it's, you know, it's come up to large numbers. in the state. But that particular variant does not have the mutations in the spike protein that we are worried are going to be, that could be a problem with how effective the vaccine is going forward.
So one last question, and that is, I heard this morning that there was I think a World Health Organization study about the origins of the coronavirus. What does that tell us? I mean, to find out where it started.
Yeah. So there, as Brent is alluding to, and as I'm sure as many people heard this morning, a World Health Organization team was in China trying to investigate the origins of the virus. And it is a fascinating question that I think is really important in terms of our future responses. You know, what is the risk of pandemics in the future? How do we protect against this? And you know, learning more about ways that we may be able to respond to future events. Plus, the science is, you know, intrinsically fascinating, and sometimes it's not completely clear how we're going to be able to apply exactly what we learn to our day-to-day lives. But what I would say is that although we're all very interested in the results, it's not likely to change what we're doing now in terms of, you know, boots on the ground and response, however it started.
Oh, okay. So, Lisa, I lied. One more question. Will there be another chart type study for staff?
Yeah, and that's another good question. So I'm not aware that, you know, the chart study, as I'm sure people are aware, you know, it really enrolled many people on campus and got a lot of longitudinal information about what was going on here through many heroic efforts. But I'm not aware of another longitudinal type study, you know, of that type that is going on. I think we will see, but I think one thing that we will see is continued testing, particularly focusing on testing staff who have any type of symptoms, even if they're mild, and anyone who has had any exposures. And we'll continue to learn from that. And the hope is, of course, that we're going to see substantially less staff who are positive now that we've had such a great uptake of the vaccine. We're already starting to see that the number of staff who are positive is going down. So we really hope that will be the trend for the future.
Thank you very much.
Thank you.
Good morning, everyone. Luke Day, Chief Medical Officer here. I hope everyone is doing well on this Tuesday morning. I'm here to give an update on COVID vaccinations, so really putting it into two buckets. First, I'll talk about staff vaccinations here on campus, and then I'll talk about patient vaccinations, as that's been more of the focus over the last few weeks. So on staff vaccinations, we're continuing to make great strides in that area. We've vaccinated close to 16,000 staff members here at ZSFG and across the network. This represents about 99% of all of our staff who have wanted to receive the vaccine have now received the vaccine, and most have completed both doses. So that's really impressive. Our declination rate is still very low. It's under 5% when we look at the data. A couple of questions that have come up right now. What if I've not received an invite for the vaccine? Or what if I've changed my mind and now want to receive the vaccine? One, we apologize if you have not received an invite. And two, if you want to receive it, you can. So each of your areas has designated an individual to collect people's names and email addresses, and they will send it to me each Wednesday, and the invites will be sent out then. So you can still continue to receive the vaccine. So if you have not, or your staff have not, please have them contact your designated person in each area to submit their name so they can receive it. What about the location for receiving the staff vaccines? Some of you probably have heard we're considering changing that, and we are. So this is the last week we will be offering staff vaccinations in 4E. Moving forward, so after the holiday, so starting a week from today, we will be offering staff vaccinations in the Wellness Center. That will be Tuesday through Friday. The following week, it's going to change to Tuesdays and Thursdays. So we'll be decreasing, we're going to change the location of staff vaccinations, and we'll be decreasing the days in which we operate. This is because we've vaccinated so many staff to date that the numbers have declined significantly. And this is really to actually pivot to trying to increase our patient vaccinations. So where are we with patient vaccinations? So we continue to do well in this area. We've vaccinated about 10,000 of our ZSFG or health network patients as of today. We represent, the last time I looked, about 25% of all vaccinations in the city of San Francisco. So we bear a large majority of the vaccination effort. Our sites right now continue to be the Learning Center. So in building 30 on the second floor, and it's Monday through Sunday, 8 a.m. to 3:30. And then it's Carr Auditorium for this week, but starting this Saturday, we're going to actually change to 4E. So moving forward from this Saturday on, it will be the Learning Center and 4E for patient vaccinations. 7 days a week, 8 a.m. to 3:30 p.m. Our goal is about 1,000 to 1,200 vaccinations of patients every day during our vaccination strategy. Couple of things people have asked is who is eligible to receive patient vaccinations. So one, any of our patients, so patients who receive care at ZSFG or within the San Francisco Health Network who are over the age of 65 can receive the vaccine here on campus or at the sites across the city. The other thing, we've also relaxed the restrictions around the surrounding zip codes around ZSFG. So this includes the Mission District, Heights, Bayview, Hunters Point, and Potrero Hill. If you live in that zip code and you are over the age of 65, you can come to ZSFG regardless of insurance to receive your vaccination. So again, patient vaccinations will be in 4E and in the Learning Center starting this Saturday. They'll be every day. It's open to patients over the age of 65. And specifically, if you have patients or people that live in the zip code surrounding the hospital over 65, they can come to ZSFG regardless of insurance to get the vaccine. As most of you probably have heard, one of our rate limiting steps right now is just the supply of vaccine, and that's true across the country and in the state. San Francisco and also ZSFG and the network are well prepared to increase our vaccinations. A lot of that is just dependent on supply. So overall, we're happy with where we are. We think we can do more, but I think we're continuing to do our outreach to our community and also to our staff to ensure that everyone receives a vaccine. With that, I'm happy to take any questions.
So I'd like you to go over the location thing one more time because it's kind of complicated, a lot of moving pieces.
So for staff vaccinations, staff vaccinations will change as of next week. So next Tuesday, staff vaccinations will be at the Wellness Center, 8 a.m. to 3:30. After that, so the week after that, it will then change to Tuesdays and Thursdays. But starting next week, it will no longer be in 4E, it will be in the Wellness Center for staff. For patients, it's going to continue to be in the Learning Center, which is over in building 30 on the second floor. Starting this weekend on Saturday, 4E become the patient vaccination center. So starting next week, it will be 4E and the Learning Center for patient vaccinations.
General question here. How do we decide who we're going to vaccinate to get in that eligible group?
It's a great question. We are not the decision makers here. We rely on guidance from the state, so from the California Department of Public Health and also CDC guidance. So they've set up a tiering system, which basically lists individuals who are considered at high risk of contracting COVID or having a complication from COVID. And so they have a very detailed outline of this. Those then get sent down to the counties, and then each county can decide how they want to implement that particular tiering system. And so we defer to the Department of Public Health, and in particular, the COVID Command Center. They have an entire team that is dedicated to looking at how we will allocate the vaccines. So I know there have been many questions around, can I bring a family member in? What about someone who lives with me? All are great questions. All of that is being considered by the state and by the Department of Public Health, but we rely on them for the guidance about who we can offer the vaccinations to.
Any sense of when the age will drop to broaden the eligibility, or other characteristics, workers in different kinds of organizations?
Great question. As I had mentioned earlier, I think we are prepared to increase the number of vaccinations we can offer to patients both here at ZSFG and across the city. It's all really related to supply. So the more supply we can get, the more we can vaccinate. We want to make sure that we reach our 65-year-old patient population. We're trying to reach a threshold, I think, of close to 80%, if not higher, before moving to the next tier.
And we're at about 30%.
Yes, we're about 30%.
Okay. You mentioned supply. What are the issues with supply?
Yep. So another great question. There are a couple of things. One is the transparency around how much is available, and then also the process of it going from the federal government to the state government. We don't know essentially week to week about how much we will get. And so you can imagine they require special refrigeration. They expire after you open them. So all of this requires a lot of coordination. And if you can imagine of not knowing how much you're going to get each week, that makes it a little difficult to plan. We would hate to have to turn people away because we didn't have supplies. And so we really are planning week to week, sometimes day to day, based on the unavailability of some of the vaccines.
So let me ask you one more question. You said that our declination rate here, in other words, the people who are offered a vaccine but decline to take it, was under 5%.
Correct.
I've read reports from many other places, including many other hospitals, where the declination rate was, 30+%. What's the difference, and what do you think that says?
Yep, another great question. So I was on a call yesterday among California hospital CMOs, and most of them were also talking about vaccine supply, but also talking about their declination rates. And many had reported declination rates of their staff of about 30 to 40%. So much higher than what we're seeing here. I think this is just a testament to our staff and the residents of San Francisco in terms of, I think we've done a good job of communicating out information about the disease, about the vaccine. We've been very transparent around the process. And I think also, we've tried to sort of give as much information as we can so people can make informed decisions and answer as many questions as possible, which I think potentially may not have been present in other areas.
So final question at this point, and that is, you mentioned that we're taking people from the zip codes that are around the hospital.
Correct.
How do people who live in those come here and get vaccinated?
Yep. So we are doing a significant outreach to our local communities around the hospital in those specific neighborhoods that I mentioned. We've done a media campaign. So many of you probably saw late last week on Telemundo and Univision highlighting both our vaccination clinics here. We've also had media print. We've also reached out to our community-based organizations in each of these neighborhoods. We also have, in some of the clinics or in some of the areas, they're shuttling patients over to the hospital so they don't have to walk, but it's dropping. So we have been doing our best, and also that's why I bring it up to all of you, is to outreach to our community to let them know if they live around the hospital and are over 65, they should and they can drop into the hospital to receive their vaccine.
And that would be the Learning Center or 4E when it's open? Correct.
We're telling people to go to the Learning Center right now because that's the consistent one. And if it's too full at the Learning Center, then we have been moving people over to the alternate location if there's availability. I'll share the grid that we have because I know there's a lot of moving pieces and dates on the locations. Share the grid with you, Brent, if you want to send it out. That clearly outlines the changes over the next few weeks.
Perfect. That would be great. We'll send it out there.
Any other questions?
Okay. Thank you.
Thank you all, everyone.
Don't go far. Okay, Kim, let me get your slides up. And go. Sorry.
Great. Hi, everyone. I am here to present with Jennifer Boffey, our Chief Financial Officer. She's on the line and will be available to answer any questions. But today I want to talk about ZSFG grants and gifts process for 2021. So just to give you a little background, grants, these are initiatives, business initiatives that go through an external donor or through the foundation. This excludes Hearts grants. So the process that you adhere to in submitting a Hearts grant every May, that will still stand. This is for grants that are outside of the Hearts grants cycle. And so that's what we want to talk about today. So the purpose of this is to share with you guardrails and guidelines that we, the executive team, the finance and operation team, have put together to make sure that we adhere to the mayor's and the mayor's mandate. So number one, we want to put together guidelines that allow us to properly accept the grant through our proper channels. So through DPH Finance, Controller's Office, Mayor's Office, and then the Board of Supervisors. So that's number one. And secondly, these guidelines are supposed to help us properly spend the grant by adhering to our City and County of San Francisco procurement rules. So meaning they have to be an approved vendor and they have to follow the procurement process that has been set to us by the Controller's Office, DPH Finance, and so forth. So our request to you is if you are intending to submit proposals for grants through the foundation or with the donor, we ask that you submit proposals to your executive. The executive will review and then connect you with the finance, the ZSFG UCSF finance team and operations. We will prioritize, the executive group will prioritize these initiatives every month, and then we will work with the foundation to make sure that it aligns with our mission and vision, and then of course the guidelines that we talked about, that it also adheres to our City and County of San Francisco rules in terms of accepting the gift, and then in terms of procurement. So without going into too many details on the documents that you see on the screen, when your executive does vet or approve of your intention to submit this proposal, you'll then work with us, and this is the standard work in place that the finance and operations team have put together, and we'll guide you through the process to make sure that it adheres to those guidelines. So this is an FYI for you. It will be available either on the Daily Digest or via email for further details. And of course, you're welcome to reach out to us if you think of questions along the way. But just make sure you keep your executives in the loop, and we'll be here to support you. So that is the gift and grant process for 2021. I'm happy to take questions.
So a couple of questions, Kim. What are examples of grants? Like what kinds of monies are people requesting from the foundation outside the Hearts process?
Absolutely. So outside of the grant process, departments may have initiatives, and something that comes to mind could be the Kaiser grant for our electronic health record, or it could be for social medicine. Business initiative and donors reach out and want to provide support and ongoing operational support for these departments to reach their targets or goals. And again, this is outside of HEARTS grants, so there's communication with the foundation, with the requester, in achieving these goals. So those are the types of initiatives or grants we're talking about.
And those grants, I mean, that process has been going on for a while, right?
Mm-hmm.
Have there been trying to address with this kind of standard workflow process?
Yeah, absolutely. So a few months ago, the mayor's mandate was that all foundation grants, donations have to go through a proper vetting process that aligns with our City and County of San Francisco procurement rules. We haven't followed that stringently, and so we just want to make sure we're pulling all that together and properly following that.
And again, where can people get the standard work and the forms?
So we will email that out through the Daily Digest along with this recording. And with your executive, they will have possibly all the answers that you require, and then they'll connect you with us if there are further questions. Fine, but don't see any other questions.
No.
So okay,
I think that's
perfect.
it. Sorry. Okay, 1 second, Terry. Okay. Here you are, friend. Got the big screen for you.
All right, great. Good morning. I'm Terry Salt, here to talk about capital programs. We got 3 active projects: rehabilitation, relocation, poison control, and 6H surge space. The rehab project continues to be to work its way through to completion. Right now is pushing further into spring. We're looking at late April completion. But once we're complete with that project, it's going to be quite the beautiful rehabilitation department. Poison control, which is on the 2nd floor, it's going to relocate poison control from the CHN building and bring it in-house or into the house. That has had a successful fire alarm test, and we hope to close this project out shortly for a relocation at the end of the month, hopefully. Or possibly early March. 6A has not had a successful fire alarm inspection yet, so as we work towards that, we'll be able to identify a date for completion, but that one is near complete as well. Talking about the next thing I'd like to talk about is our support of COVID-19 projects. Not just facilities and capital programs, but all support services go into a very large support mode in supporting these efforts. So, as you heard from Dr. Day earlier, all the moves with the vaccine centers, where the 4E center is going to be converted to a patient vaccine center, and the wellness center is going to be converted to a staff vaccine center. That takes a lot of support service and facility support. So that is ongoing. One of the other early projects that are related to the COVID-19 effort is the campus restrictions, locking down of access to certain areas of the building. One that we have been on is the access to 30, 40, and 9. This got complicated with the advent of the patient vaccine center and the learning center, but we were moving forward with the restriction on the south side from building 9 to building 40. So far, we have installed the door and installed an access reader with an automatic operator on the door. But there's also an intercom that will allow people to reach out to building to gain access to the building. That is being perfected, and once that is perfected, we'll be locking down that door on the south side. The other projects, capital projects that are moving ahead is the big one is, of course, the seismic upgrade, and that's going to be a more of a marathon than a sprint. And that's getting started right now with that's going to happen in the outpatient department lobby. We have already relocated the phlebotomy lab from that lobby to the main lobby, and we're working through those issues with that move. But we will then be moving into the pharmacy and doing some reconfiguration and put up some barricades to get started for the seismic work that's planned in the pharmacy. We are going to try to align that work with a Clin Lab project, installing a automated track system. So that will be in the same impacted area, so that will be happening at the same time. So look forward to some reports on those activities on future management forums. I do want to talk about UCSF research building construction. It's been going pretty smoothly on the south side of campus. I do want to bring to everybody's attention, well, the activity that's going on right now. If you look up, there's a lot of underground utilities, concrete foundation work. They've spilled out into 23rd Street, into Vermont, doing fire hydrant connections and natural gas connections to the building. But the big thing that I want to bring to everybody's attention is the future noisy work. From our experience with the rebuild project, by far the noisiest parts of the project is the steel construction, where they erect the skeleton of the building, and then they lay down the steel deck of the building. There's a lot of saw cutting, a lot of wrenching, pneumatic wrenches on structural bolts on the building. So we do expect this to be this spring, starting in late February, March. I believe in February they're going to start having planes come to the site and start the steel construction erection in March. So that will continue on into May. I do want to give everybody a heads up. It's going to be noisy. We've been through this before. And if you are in a location that faces the construction, you may want to consider, how this will impact you. You can take. We will make earplugs available, as we have in the past on other noisy projects, as well as we are sampling some telephony headgear so that you can have phone conversations while the work is noisy. So we will have a small inventory of that for to be made available as needed once we've selected the product. So we're getting ready up for this noisy period, about 3 months of noisy work. And I will be repeating this message to every time I come to the management forum that it will be noisy. What else can I tell you about that? That's about all for the rebuild, not the rebuild, the UCSF research facility construction. I do want to bring up what I always bring up at the end of my presentations is that we still have San Bruno parking available at the reduced rate on San Bruno. So please apply if you're looking for parking on campus. With that, I will end my presentation and take questions.
Okay, here's one.
Yeah.
Where is poison control being located?
Poison control is being located on the second floor across from medical records.
And what space was that before?
That was the doctor's lounge, the residence lounge.
Oh, right, okay. So UC Research Building, we're talking about a noisy spring. What are we going to see during the 3 months of?
Yeah, the structure. It's going to be a mesmerizing and exciting time where we see the skeleton of the building take form. And then once that is done, you'll see the steel get built up, and then you'll see the decks be laid down with the metal decking. It's when they're cutting that metal decking that it gets really noisy. But then once that skeleton is built, then they can start putting the skin of the building on, and it'll happen, fairly quickly once the skeleton is built.
And there's is work going on the roadway that's going to connect the turnaround up to Vermont?
Yeah, so the roadway work is actually a separate project. It's the same project, but they're treating them as two separate projects. They have a separate permit because once that roadway is completed, they're going to hand that roadway back to the city, and then they'll focus on the construction on the building itself. So we're looking at that being brought back to the city's access sometime late spring.
So that'll be that's a spring project also.
Yes.
Doing the roadway. Could you talk a little bit about the seismic upgrade here in Building 5 and kind of what that's entail and what that?
Absolutely, but I want to go back to the last question.
Okay,
so to be clear, the roadway is going to be given back to us. It's going to be done, completed in the spring. So the asphalt's actually going to be going in this next month, or actually sooner than that, in the next couple of weeks. The asphalt will be going in. As far as the seismic work in the building, well, that's going to be with us for some time. That's going to be a big effort. There's multiple different pieces to this. And as the plan, I've been telling you for some time, as the plan hardens up, I will provide information. Because we know what the work entails, we just don't know how all the puzzle pieces are going to fit together. We're working with our contractor, PanCal, who's provides a schedule, and there's a lot of back and forth on that schedule. And I certainly wouldn't want to present a schedule that wasn't accurate. But the work entails basically 3 different types of work. One is column strengthening, where they actually add bulk to the columns. Another aspect is where they strengthen the column by wrapping it with a fiber wrap to strengthen the columns. And in other areas, they don't want to strengthen it, they actually want it to be more flexible. So we'll be doing I always call it a cake slice, but we start at the 7th floor, we cut, there's an expansion joint between the M wing and the main hospital building. It's about 6 inches wide right now. It needs to be expanded to 24 inches, 22 to 24 inches. And so they need to basically expand that at every single floor as we go down to the 3rd floor to have more room for expansion on that tower. So that's going to impact access to the clinic on the M wing. So part of this seismic effort will be to temporary relocations of clinics to other areas in the hospital so that our patients will have ease of access, and the work that has to happen in the clinic itself won't impact patient care. So it's the column strengthening, it's the expansion joint, and then there are elements on the exterior, sunshade elements that have to be removed to allow for the strengthening of the columns.
Huge.
Big effort.
Yeah. Last question for you, Terry.
Yes.
What's going to happen to the old poison control location at CHN?
There's going to be a renovation project over at the CHN building, supporting the current occupants in that building.
Okay. And when is that?
That'll happen right on the heels of the relocation of the poison control.
Thank you.
Thank you.
Susan? So
Right.
not much happening.
Not much happening at all. Wow, that was a lot of information, and I really want to thank Lisa, Luke, Kim, Jennifer, and Terry for all of the amazing information that they provided for us. Really want to thank you for your active participation, for being here, for asking a lot of great questions. And most of all, I want to thank you for your work over this past year and always, but especially this past year, your expertise, your compassion, your resilience, your creativity and flexibility, it's really second to none. So thank you for that. Thank you for being here. We'll have another great program for you in March. And I look forward to seeing you out there. Thank you. Have a great day.